And then what is the now? What do we do? What are the treatments?
So fortunately, there are things you can do just at home, especially if the incontinence is mild or moderate. Something just as simple as controlling what type of beverages you're consuming and at what time of the day you're taking them. So anything that makes your bladder be irritated or makes you want to pee more, you want to cut back on. So big, big contributor to that is caffeine,
Mm-hmm.
carbonated beverages, coffee, and alcohol as well. And also keeping in mind the timing of it. So, a lot of us have been told you should drink 8 glasses of fluids a day. Keep in mind, not much to be gained by having more than 8 glasses. And also, that fluids includes everything you're drinking through the day,
Including your tea.
not just water. So keep that in mind. And also, try not to drink so much right before bedtime. Especially in that time period, you don't want to have more than 2 or 3 glasses in the hours leading up to that. If you're significantly overweight, we do know weight management helps as well. And if you tend to be constipated, increasing the intake of fiber in your diet to 30 grams a day can also be a benefit.
Okay. Are there exercises that you can do to prevent some of this from happening?
There certainly are. And again, I'm sure some of our listeners have heard about Kegel exercises. And these are pelvic floor, the pelvic muscles that we mentioned earlier, exercises that we can do to strengthen that pelvic floor so that we have less chance of having stress incontinence. And so the pelvic muscles, it's kind of hard initially to target those muscles because you don't really know, you can't see them moving, unlike, if you're flexing your bicep or something. But the great thing about them is that you can do them whether you're lying or sitting down. No one knows you're doing them. In fact, any one of us could be doing them right now and nobody would know. You can train your muscles to work. And the way that you do this is, and it starts speaking in layman's terms here, okay? So imagine yourself trying to hold in a fart. Okay, so you've got to pass gas, but you're like, you can't do that. So it's a contraction of the rectal muscles. Plus, also at the same time, you want to contract your vaginal muscles. So you're going like as if, okay, I can't pee, so I've got to contract my vaginal muscles. I can't fart, so I've got to contract my rectal muscles. It's those muscles that you want to be trying to contract at the same time, even if you can do it mid-pee in the middle of a stream of urinating. So the way that you do it is you start very sort of light because it's hard, again, to know how to do it properly. But you want to try to contract for 3 seconds and then relax for 3 seconds. And then you want to do that 10 times in a row. So you have 10 repetitions. And then you want to try to repeat that at least 3 times throughout the day. And again, nobody will know you're doing them. You can do them sitting at your desk or lying in your bed. And the idea is to kind of slowly work up to doing it for 10-second contraction holds. And that will make a huge difference in your ability to manage and prevent stress incontinence.
And you can do this at any age and it will improve?
You can, exactly. Yeah. It's often recommended after a vaginal delivery to help the pelvic floor to kind of come back again. Key point here is that you're not clenching your gluteal muscles. You're not clenching your butt muscles. It's a very different set of muscles. It's a very, small movement that has great benefits.
So when you're doing it, you won't actually see any contraction.
Correct.
From the outside.
Nobody will see.
It's all internal. Okay. Dr. Madhu, any other treatments?
You can do bladder training. So it's like training your bladder, almost putting it on a schedule. So you can pee every 30 to 60 minutes and you draw that out to, okay, I'm going to go pee every 1 to 2 hours. And finally, you're going to every 3 to 4 hours. And the point of that is to train your bladder that, okay, we're going to go pee every 4 hours. And you're not going to wait until your bladder's so full that you have to run to the bathroom, which we all do. We're like, oh, I can wait a bit longer. Like I've done that on planes where I don't want to use the airplane bathroom. And then as soon as I'm off the plane, I'll just wait till I get to the hotel. And as soon as I'm at the hotel, then it's just game over. Then I'm like running to the bathroom.
Yeah. So at least you make it all the way on a flight to the hotel.
Yeah, so far. And then I won't drink it. Like Dr. Deethy said, I won't drink anything during the flight, which is terrible. You're dehydrating yourself or whatever. So yes. So you can train your bladder. And then going back to what Dr. Nav says is just to do those pelvic floor exercises. You can even get a pelvic physiotherapist. The wait times for them are usually quite long because this is a real problem, and you can get a specialized physiotherapist who can actually teach you how to do the exercises. But I think one simple way that maybe all of us can relate to is that when you pee, try to stop peeing midway and then pee again. And you will realize it's actually very hard as you get older to stop peeing midway and then do it again. And that, I think, is a good example of what you were describing, right? Because it's really hard to describe. I mean, you did a great job, but I would just try to stop peeing midway while you're sitting on the toilet. And that is what you need to do the way Dr. Nav explained it.
So you're going to pee anyways, you might as well get some exercise out of it.
And realize how weak those muscles are.
Okay, so let's say you have the problem of incontinence. You're leaking pee at inopportune times. You have tried the Kegel exercises. You've tried the bladder training. You've tried not to drink too late into the evening. What if those don't work? What are some of the solutions then?
This is a good time to go see your primary care provider to discuss things that are more medical to do. One of the things that can be considered is medication. So if you're perimenopausal or menopausal, the topical application of vaginal estrogen can help to reduce incontinence. And then there's another thing that some of us may have heard of. It's called a vaginal pessary, which is a device. Usually, it comes in different shapes and sizes, but the most common one is kind of like O-shaped, O-ring shaped. I don't know if you can, this looks like an O, but it's made out of silicone. And you insert it into your vagina, and it presses against the wall of the vagina, and as a result, it also presses the urethra. And that can help with incontinence, particularly if you are one to have incontinence that's episodic. And for instance, you know that whenever you go exercise that it's an issue, and you could insert, and women can be taught how to do them themselves, where they insert the pessary when they need it. The thing to keep in mind about a pessary is it can be very effective, but you can't just leave it in there all the time. You should take it out and allow at least overnight every week or so to be without the pessary. And you also have to clean the pessary with soap and water episodically as well to reduce the risk of infection. But it can be a good temporary solution for some women. And if the things that we've talked about so far aren't as effective, surgery can be considered, and this is where a referral to a urogynecologist can be very helpful, particularly if your symptoms are severe. And procedures that they're able to do, surgical procedures, can greatly alleviate these problems in many women. Other things that can be considered, which we're not going to get into today so much, are urethral bulking agents, peripheral nerve stimulation, which is kind of quite popular right now, acupuncture, laser therapy, and even applying Botox to your bladder.
Yet another use for Botox.
Oh, this is so interesting, but it's really nice for me, and I'm sure our listeners, to hear that there are different levels of care and treatment that you can try. So always start with the one that you have under your own control, and then from there talk to your family physician or your nurse practitioner, and then get more assistance if it's not working for you. Any other tips for?
I'm really glad we're talking about this, because I think it's really important to normalize this conversation. And I think a lot of women probably don't realize how common it is. And I think it's really important to advocate for yourself and talk to your primary care provider so you can figure out how to manage it, because it does affect your quality of life, and there's something you can do about it.
Yeah, there are, you'd ask for sort of other things that we can do to help ourselves if we, along with the things that we've mentioned today. I think we should also talk about other things that you can just buy over the counter, and that includes things like incontinence pads. And these are, pads specifically designed for women who have some urine leakage. So they're not like the big bulky pads of olden days. These are very small, discreet, and they hide urine odor, and they prevent your skin from getting irritated if you do happen to have a little bit of leakage of urine before you can get home and change your underwear. So they're really good, and they're really helpful, and they're available over the counter. You can also try zinc barrier creams, which again, similar to diaper creams, but of course we don't want to, say that the two are the same. And so they're marketed differently, but they do exactly the same thing, which is to prevent contact of irritating urine against your skin. And then, invest in some mattress pads, sofa covers, if you're worried that you're leaking so frequently that you might end up inadvertently leaking into furniture that would be really hard to get urine out of. So again, these are things that you may not know about or people may not have told you about, but we're here as your medical best friends to tell you that there are lots of options available to you.
And could you use panty liners that one would use during a period? Would that be as effective
Are
as
they as absorbent? I don't know actually.
Okay.
I think it depends on how much you
yeah.
I don't think it's as absorbent.
I don't think it, like a panty liner is pretty flimsy. It's more to absorb mucus and stuff like that. So I don't think a panty liner would suffice. Yeah.
And all these products, you said you can get them over the counter. You could get them at your local pharmacy or Shoppers Drug Mart or wherever you get your products from. Well, this has been a great conversation. I think that a lot of us don't talk about incontinence because we feel ashamed. We haven't talked about it before, but ਇਹ ਕੋਈ ਸ਼ਰਮ ਦੀ ਗੱਲ ਨਹੀਂ ਆ. ਇਹ ਸਾਡੀ body ਦੀ natural reaction ਆ, ਇਹ ਸਾਡੀ age ਆ. So we should be able to talk about it with each other because that way we normalize it and we can maybe get more
we don't want to be ashamed about it. And there's solutions. That's the thing. Ask.
Yeah. You don't have to live with it, basically.
Yeah, well, that's a really good sort of way to wrap it up. You don't have to live with incontinence. Are there final words, doctors?
No, just go talk to your doctor and don't be ashamed and get help.
And start a conversation with your friends. You'd be surprised how many of them are in the same boat as you.
Do we need to have a pickleball conversation?
I just had one yesterday with my friends.
Well, thanks for listening. We hope we gave you enough information about incontinence, about holding in your pee, and what happens as you age and as your body changes. There's solutions, there's treatments, and there's support in your friends and your family. So please reach out to them. If you want any more information, please DM us. As you know, we're on Avaaz_voice on Instagram. We're also on YouTube and Facebook and on TikTok. Pretty new for us. So we look forward to hearing from you. Give us your ideas for other future topics and listen in. We'll be here for you all the time. Thanks.